Today I'm here to tell you about something that will simplify your life. It's Healthspek, and it's a personal health record mixed with a little bit of magic. But first, the basics. Healthspek not only allows you to store your own personal information, but collects your information from your doctors and hospitals for a complete health record. Healthspek responds to two basic questions. The first is, where is your chart? Unfortunately, it's in bits and pieces everywhere. It's in your primary care doctor, it's at the hospital, and it's even in pieces in your kitchen drawer. The second and more important question is, where isn't your chart? It's never where you need it. It's not with you on your vacation. It's not with the specialist you're about to visit. And it's not available for your family to have access to it to help give you care. Enter Healthspek. Healthspek allows your record to be accessed anywhere in the world, anytime, anywhere, 24/7. You simply provide a secure access code to a doctor or a nurse who can then instantly access your record through Healthspek's chartnow.com website. And here it is, beautiful, easy to read, and complete. And not just the clinical information, your doctor can see your legal documents such as living will or power of attorney. What's more is we provide you with a carry card, the front of which gives you identity and insurance information, the back, medications, allergies, and contact. Most important is that access code, again giving instant access, in this case, to emergency medical professionals. And here's Healthspek's best feature. Healthspek gives you a multi-page dashboard with actionable specs chosen by you to fit your needs. You tell Healthspek what's important for you. For example, if you take medications, you'll use a spec that reminds you when those medications need to be refilled. One tap to refill. You'll use a spec that reminds you when to take those medications. Again, just one tap. In short, your dashboard becomes you. Now, these specs you'll use throughout your lifetime. For example, to remind yourself of health maintenance items such as a mammogram, or where am I in my insurance deductible, or even price compare procedures such as a colonoscopy. This ecosystem of specs is available to consumers throughout their lifetime, providing value. In short, Healthspek is the best personal health record on the planet. But don't take my word for it. Third parties all agree. Apple, for example, has named us to their best new apps list. Healthspek leadership begins with me. I began my career right here in Boston with Bain & Company's healthcare practice, and then moved soon to Nashville to found Vanderbilt's healthcare insurance plans. My partner has operated rehab and fitness facilities in 3 different states and has developed population management programs for hospitals. Together, we have 60 years of combined healthcare experience, the most important of which was this past decade when we founded and started one of the most successful nationwide resellerships of eClinicalWorks, electronic medical software for physician offices, gaining key experience that will carry into this decade our vision, our experience, and our success. This will be the decade of the personal health record. That's us. The best thing about us is we're both card-carrying members of AARP.
Very nice.
Thank you.
Very nice. Okay, Randy. Have you ever seen that episode of South Park where they have the underwear gnomes?
I have not seen that episode.
Here it is. The underwear gnomes, they say, I have a great idea for business. Underwear gnomes. Okay. Great idea for business. First, we collect all the underwear. Then we make lots of money. And that middle part, the unanswered question, how does all that data get from all the way over here in the disparate, the hospitals, the health plans, into that repository? Because the patient sure as hell isn't going to put it in there.
A couple of different ways. Healthspek is able to accept a format called continuity of care document that every EMR, every electronic medical record in a physician or a hospital is able to produce. So we accept those electronically.
Able or willing?
Able and willing, correct. Able and willing, so we're able to accept those. We're also forming partnerships with large holders of data, such as insurance companies and clearinghouses, to have users be able to opt in to automatically download what information they have to pre-populate the record.
All right. Questions, Peter?
Who pays?
This is a free app. Now, if you remember the dashboard, which is unique to our product, there's specs on multiple pages of those. Most of those specs are free. Some of them are sponsored. So, for example, we have a company called Relation, who is a competitor of Phone Tree and Televox, health maintenance and appointment reminders. They pay for that space. They give us around $5 to $7 per doctor per month, because their customers are the doctor. They pay for that space. So it'll be a different revenue model depending on the revenue model of the sponsored spec.
How is the updating happening? So you've gotten all the information from the records and you continue to go to the doctor and meet. How do you update?
Okay. There's a program coming out called Blue Button Plus. We are working actively with people like Adam Dole at the White House to be compliant with Blue Button Plus, and that's precisely the point of Blue Button Plus, not just to get the initial data, but to be able to update it.
Just to continue on that thread and just to focus on the provider scenario. So on one end, you described the emergency call, having the card, and you had a URL for those providers. But we all know in the ambulances, usually radio is typical. How are they going to be able to access the URL on that end to really get the full EHR database? And then on the kind of opposite side of the spectrum, I want to continue to talk about, do the providers really want to give you that access to the patient record versus going through a provider-based portal to prevent leakage of patients, et cetera?
Okay, let's take the first question. More and more emergency vehicles are able to access small screens like mobile devices with a full URL. However, even if they don't, remember we have that access code that gives you, this card that gives you allergies, medications, and contact information and insurance on the front. So they do have minimal information that they don't otherwise have. Your second question, give me that again.
Really on the provider level. So everyone wants to own the patient, right? And
everyone wants what?
Everyone wants to own the patient.
Yeah.
So why do the providers, which most of them will have customer portals to prevent leakage from their systems, want to give you information where you give that power to the consumer to then go to different potential hospital systems over time?
Okay, two answers to that question, carrot and stick. The stick is that HIPAA requires them legally to provide on request electronically formatted data of yourself. That's the stick. The carrot is we will be forming partnerships, we call it our community project, where you can do population management and those kinds of things through these specs, because these specs not only provide information, you can input information like tap off, what was your pain level today, what was your urine color, did you do your glucose reading, what was it? It'll automatically feed that data back. So we believe in the near future, provider organizations will be cooperating with us fully because they'll be able to manage their populations better, and then that information will be free-flowing.
Do you anticipate that consumers will actually input data into the system on an ongoing basis? Because
our early
experiments have not worked out so well for Google and Microsoft.
Our early adopters are the AARP crowd, especially those with chronic disease. And yes, they are willing to. Large numbers are not willing to, which is why we're working on these pre-population programs with insurance companies and large clearinghouses.
In a fee-for-service world, the doctor's time is directly related to money. Is this an additional step for them to either look up onto your health record as well as their health record? And do they have to enter the data in two different spots?
No, they don't have to enter the data in two different spots. We believe, and this is not to replace an electronic medical records. If you're a primary physician of somebody, you're probably not going to need to look at the PHR. For example, though, if I show up at a specialist's office and for some reason, which often happens, they never got that record, look what you have, an 8-digit code, they bring it up on their screen. They'll be happy to have that. It's not an extra step in their mind.
Great. Other questions? Anyone? Okay.
How do you secure the data?
We're hosted by Rackspace, which has HIPAA-compliant encrypting of the data. We transport via 128-bit SSL transport.
And one more. Who owns the data? The consumer, you, or the providers?
The consumer owns the data, unquestionably. We used Waller Lansden to have a terms and conditions sheet that allows us to do things like, for example, imagine a farm company wanting to do a drug trial. We can send messages to all women over 50 that have had a diagnosis of breast cancer in the past 5 years, and we can send a message, do you want to opt into this drug trial? And once they opt in, they can share their records with the drug people and even be administered for the home-based administration of that drug trial. They can do that.
Great. Any other questions? Okay. Thank you very much, Randy. That was great.
Thank you.
All right, we're going to vote. I like that Randy is over 50. I think that's great. There's actually a lot of entrepreneurs over 50. Number one, voting question, you know it. We'll sing that old refrain. Does this company or product address a significant need? There's a quote that was in an Atlantic article recently. Genius, it seems, happens when a seasoned mind sees a problem with fresh eyes. It's an article about people who are entrepreneurs in their later life. The Marion Ewing Kauffman Foundation has done research showing that the average age of founders of technology companies is actually 39, with twice as many people over 50 as under 25. Next question, please. Is this product or service unique? 1, absolutely not. 10 is absolutely yes. And that same, there's also MetLife research showing that there are about 34 million seniors who are or are wishing to start their own businesses. It's a pretty stunning number. Actually, the Edison folks this morning, I think a lot of their folks come from the senior entrepreneur crowd. Third question. Will you use this product or refer this product or service to family and friends? 1, absolutely no. 10, absolutely yes. Actually, if you look over the last 10 years of entrepreneurial activity, the highest rate of entrepreneurs is in the bracket of age 55 to 64, not in the younger age bracket that we all typically associate with entrepreneurship and Silicon Valley and all this stuff. There was a big report that the Kauffman Foundation did called The Coming Entrepreneurship Boom. It's a great report. It's worth downloading and checking out.